Hello, good evening, everyone, and a warm welcome to today's OET webinar, proudly brought to you by Global Nurse Force Career Pathways in collaboration with Specialist Language Courses, or SLC, Europe's first accredited OET preparation partner. So, this session is designed to give you a real taste of our OET training experience. It's a chance to explore what our classes are like before you commit. And so that's why we are calling it Just Try Before You Buy. Whether you're just beginning your OET journey or have attempted it before, you're in the right place. Today's session is all about understanding what makes a strong preparation plan and how our expert-led training can support your journey to success. So grab a notebook and stay engaged. We are going to be revealing a few offers exclusively for those attending the session. So please stay tuned till the end, and we are going to start now.
Hi everybody, my name's Chris and I am sitting here on the south coast of England. It's a beautiful day, the sky is blue, it's sunny, it's about 25 degrees. I'm going to be talking to you about the OET writing. Good evening. Good afternoon here. We're a few hours behind you. India is always ahead of us. You're in the future. So I'm going to be talking about the OET writing, and specifically, I'm going to be talking about the OET writing, writing the purpose in your OET writing letter. So I'm going to share my screen. So bear with me. Okay. So writing the purpose. So as many of you know, and for those of you who don't know, when you do the OET test, the writing paper consists of a set of case notes that you have to write a letter, typically a letter of referral or a letter of discharge to someone who's identified in the task with, and asking them to do something in particular, typically to provide care for a patient. So in the letter, you have 180 to 200 words, not much time, not many words. And so you have to write the letter very carefully. So very super important is how you start the letter. And this is what we're going to be talking about in my section of this webinar, and then I will hand over to Kamuda, who will talk about the next stage in writing a letter. So I'm going to be talking about writing the purpose. The purpose is the reason you are writing the letter. And this is super important because it starts the letter in the right way and allows you to continue in the right way, hopefully as well, by selecting the information from the case notes that you need to write the letter appropriately. So first paragraph, what do you need to write in your first paragraph when you write a letter in the OET writing test? So this is the purpose. State the purpose, state the reason for you writing, and include essential information. Now, this is a very short paragraph, 2 sentences, no more, sometimes even 1. So it's pretty short. So you've got to get the key information into that short paragraph in such a way that the reader really understands it. So you need the name of the patient, pretty clear. You need the context. So how the patient is connected with you, what the main medical issue is, and you need the reason why you are writing. So, for example, if I'm writing from a hospital and I'm writing to a care home manager, or I'm writing to a GP doctor, they need to understand why I am writing to them. You know, that needs to be really clear for them. And this is what OET will mark you on. So here we have an extract from a set of case notes. And we can see here we've highlighted a few different things here. The first thing, I mean, and this, what we've highlighted here are the key pieces of information that you will need in order to write the purpose paragraph in your letter. So the first thing is your role. Who are you? Who are you? Where do you work? What kind of nurse are you? In this case, it says up here in yellow, you are a nurse working on a medical ward where Mr. Hepburn was admitted for treatment for bilateral leg ulcers. So you're working in a hospital. You're a hospital nurse in this case. The patient, who's the patient? So we know that it's Mr. George Hepburn. Here's his name, top of the case notes. Here's his date of birth. So he's 71 years old, getting on a bit. And we know that he has a diagnosis of bilateral chronic leg ulcers. This will be at the end of the case notes, the diagnosis, but also here in the notes here. And then we also know that the patient is now ready for discharge. He's ready to leave the hospital. And so who is the reader? The reader in this case is highlighted in blue. The reader is Miss Vanderwater, the manager at Humbertown Care Home. So that's your reader. That's who you're writing to. And why are you writing to them? What's the purpose? Why bother writing to them? Well, because he is being transferred to a care home. That's clear. And this is the discharge plan. And you're writing to the manager of the care home to ask her to provide ongoing care. Okay, so that's the purpose, to write to Miss Vanderwater, the manager of Humbertown Care Home. You're going to give a short description of what Mr. Hepburn did at hospital, but most importantly, you're going to talk about the ongoing care that he needs, and that's the discharge plan. And what that looks like is written here. So this is the information that you will give to the person in the care home. Now, this information does not go in the first paragraph, and we're going to look at that. So in the first paragraph, you're going to put the name of the patient, Mr. George Hepburn. You're going to give the context. So he was admitted to hospital on the 5th of February for bilateral leg ulcers. And you're going to give the reason why you are writing, because you're transferring the patient to the reader's care home. Remember, you're writing to the care home manager. It's transfer to care home. That's listed here. It says here up here, write a transfer letter to Miss Vanderwater at the care home. So you're writing in order to transfer the patient to the reader's care home for ongoing care. And this is where the information about the discharge plan will come in. Okay, so if we put all that information into one short paragraph, this is what you get. I am writing regarding Mr. George Hepburn, who was admitted to the hospital on the 5th February with bilateral leg ulcers, full stop. He is being transferred to your care home and requires ongoing care, full stop. That is the purpose paragraph. That is how you start the letter. So we can see here, we've only got two simple sentences, but it introduces who the patient is, what the context, what the problem is, what the problem was, and what you're asking the reader to do. So this is how you would start the letter. So here's some useful language. I'm writing regarding, I'm writing to discharge, I'm writing to refer. So this is how you're starting your first sentence. Dear Mr. blah, 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 I am writing. And then the second part of this sentence would give the context. Who was admitted, who has recently been diagnosed, and so on. And then the third part of the paragraph is the second sentence. So the first sentence is a combination of these. So we can do this. Look, I am writing regarding your resident, Mr. O'Donnell, who was admitted to the hospital on 4th February with pneumonia, full stop. He is being discharged tomorrow and requires ongoing care. There you are. There's the purpose paragraph. One sentence describing, giving the name of the patient, gives the context, and then you say in the second paragraph, and second sentence in the first paragraph, what the request is. We can do this here. Look, I am writing to discharge Mr. Larson, who was admitted to hospital with a right hip replacement on 2nd June. And then not she, but he requires home visits and ongoing care. So there you go. There's the purpose paragraph. So let's have a look at this. Now, can you put this into the chat, please? So what's the purpose of this letter? So have a look at this letter here. You're a ward nurse, so that's who you are, working in the burns unit. So you're in the burns unit of the hospital. A patient, Robert Smithson, has been admitted to your unit from the emergency department after being in a house fire, but now he's ready for discharge. And using the information given in the case notes, write a discharge letter. So What are you doing? Are you doing A, B, or C? So yes, those who put C is correct. That's why you're writing. So you're writing to request ongoing care for Mr. Smithson, who is now ready for discharge, having been in the burns unit in the hospital. So well done, everybody who put C. Thank you. Okay. Same situation. Here's the case notes again, Mr. Smithson. And here are three possible purpose paragraphs. Which is the correct one? A, B, or C? Which is the best opening paragraph? What would you put? You tell me. A, B, or C? Now, if you remember from the previous slides, what we're doing with a purpose paragraph, we're introducing the patient, we're introducing the context, and then we're making a request. That's it. Super simple. So in this case, the paragraph which does that the best is paragraph C. And if we read this through, we can see, I am writing regarding your patient, Mr. Robert Smithson, so name of patient, who was admitted to the hospital on 6th April with burns sustained in a house fire. That's the context. He is ready to be discharged and your follow-up care would be appreciated. That's the request. So what's the problem with the other two? So A, here, this is just the opening paragraph. Some of this information in A and B is useful, but it doesn't go in the purpose paragraph. It does not start the letter. It comes a bit later. So in A, there's just too much detail about the hospital treatment. And in B, there's too much detail about the follow-up care. That comes later on in the letter. So this might be important, and the reader might need to know this, but it doesn't happen in the purpose paragraph. The purpose paragraph, super simple. Introduce the name, so Mr. Robert Smithson, introduce the context, admitted to the hospital with burns, and then introduce the request. He is ready to be discharged. Your follow-up care would be appreciated. Okay, so 2 sentences, that's all you need. Okay. Here's one more. So have a look at this. Again, put some ideas into the chat. So here are it's a selection from some case notes about someone called Mr. Edward Tidyman. Have a read of the notes. See if you can work out who you are, what the context is, so why Mr. Edward Tidyman is the subject of this letter, and then what the request is. What's the request? And for that, you would need to look in the writing task. So, what is your role? Who are you? Are you a doctor? Are you a GP? No, ward nurse. Thank you, Ankit. Yes, thank you, everybody. Ismail, thank you. Sinita, thank you. Yes, thank you. Thank you, thank you, thank you. You're a ward nurse. Perfect. Okay, here it is. You are a ward nurse working in the internal medicine unit. Perfect. Okay. Who is the patient? What's the context? Let's go down to the next one. So thank you, everybody who put ward nurse in. But what about this number 2? Who's the patient? What's his name? Thank you. Thank you, Ankit. Edward Tidyman. Absolutely. And what's the context? What's the context? Why was Edward Tidyman in the hospital? So he was admitted to hospital. The last one was because he had burns from a house fire, but this is different. Ah, thank you, Tina. Yeah, something with, GERD, something with GERD, yeah. Diagnosis of chronic GERD. But what happened in the, thank you, Surya. Yes, perfect. And Upashana, thank you. Application of links device. Absolutely. Okay. So, yeah, I'm not sure about ICU cardiac nurse, but we've got you're a ward nurse. Mr. Edward Tidyman is the patient, and he was in hospital for a planned application of a links device for GERD. Absolutely. So well done. Thank you. Okay. So that is a situation. So that's the patient. That's the context. Who is the reader? Who are you writing to? What's the answer to that one? Who are you writing to? Yeah, Dr. Berkeley. Dr. Berkeley, absolutely. Who's Dr. Berkeley? Is he a hospital doctor? He's the patient's doctor. Absolutely. He's the patient's doctor. So he's a GP. He's the patient's doctor. Absolutely. Because Mr. Tidyman, he's been discharged from hospital. So he's leaving hospital and you're writing to the doctor to tell the doctor what needs to happen now. So the purpose of the letter. The purpose of the letter. What's the purpose? Why are you writing to the patient's GP? Why would you do that? Okay. So ongoing care. Thank you, Tina. That is 100% correct. Okay. So ongoing care. Absolutely. Absolutely. Well done. So your role. Let's have a look. You're a nurse. You're a ward nurse working in internal medicine unit. Thank you. Thank you, Pradeep. Absolutely. Discharge ongoing care. Thank you, Ismail. Absolutely. Okay. So who's the patient? It's all in green here. Mr. Edward Tidyman. And what's the context? Application of LINX device for chronic GERD. So well done, everybody who put that down. Who's the reader? Yeah, we saw that. The patient's doctor. Very good. And what's the purpose of the letter? Ongoing care needs after discharge. So post-discharge care. So well done, everybody who got that. Good. So now we can write our purpose paragraph. So, can you complete the paragraph? I am writing regarding your patient, Mr. Edward Tidyman. I'm going to, there. That's what it looks like. That's what it looks like. So Mr. Edward Tidyman, who was admitted to the hospital on 20th May for, this is the context, planned application of a LINX device for GERD, ready to be discharged, but your ongoing care would be appreciated. So there we have all the information that you've just given me. It goes in one paragraph, 2 sentences. That's it. So, a couple of tips. Know where to find the important information. So look at the notes, look at the task, look at the diagnosis stuff, look at the discharge plan. Be clear. Very important. You've got to be clear. So be clear about your role, who the reader is, why you're writing. Make the reason for writing immediately clear in the first paragraph. So this whole presentation is just about those 2 sentences in the first paragraph. And 2 sentences maximum, no more than 2 sentences. And don't put detail in what happened in the hospital. Don't put detail in what the ongoing care needs are. We're just introducing the key idea at the moment. And so it's just saying, this is the patient, this is the context, and this is what I want you to do. That's it. So thank you for being such great participators. All the connectors to use in OE2. Yes. There are lots of connectors. You learn the connectors by taking classes. So those teachers will give you the connectors that you need to use. But connectors are important. Absolutely. Because they put the ideas together. They connect your sentences together. And there are lots of different connectors. Some for adding information, some for giving examples, some for contrasting information. So lots of different connectors. But you've got to get those from your teacher. Crucial to use and remember. Well, for the purpose paragraph, I think it's pretty clear, right? You just need the name of the patient, the context, and you need to say why you are writing. The other stuff, which is selecting information and organizing that information into paragraphs, Kamuda is going to talk about. Is it important to use high-end words? Not particularly. Use the language from the case notes and just make sure that the letter is really clear. You don't need to use particularly difficult vocabulary or complex vocabulary. You need to make sure that the reader really understands what you want them to do. That's the most important thing. So you can use fairly easy words, yes. Yeah. Remember, it is a medical letter. It's one healthcare professional writing to another healthcare professional. So it will need to be kind of professional language. You know, like medication was administered, not given, for example. How many errors are expected in the letter? Well, not many. Well, it depends what grade you want. If you want a B, not so many. Okay, so it's got to be clean and clear. Okay. Can we write, it would be appreciated? And yes, you can. I think we had some examples. Your ongoing care would be appreciated. So it would be appreciated if you could provide ongoing care. That's a nice request sentence. Okay, now I'm aware that I'm taking up loads of time. So I'm going to stop there and I'm going to hand over to Harsha and Kumuda. Thank you.
Thank you. Thank you so much, Chris. Kumuda, you can go ahead.
Thank you, Chris. That was very informative in a very short time. Okay, so as Chris mentioned, there are different marking criteria, and one of the marking criteria was explained by Chris, which is purpose. Now, I'll be doing the other marking criteria, which is content. That is how effectively you need to select from the case notes the content that you need to write in your letter. Okay. Now, as all of you know, it's the writing module has 45 minutes time for you to write. And in that 5 minutes, you'll not be able to mark anything on your question paper. So how effectively can you make use of that 5 minutes? And after that, when they say, okay, you can take your pen and write, that is the time they give you is 40 minutes. And as Chris mentioned already, it's a formal letter on a profession-specific matter using case notes. So you are a healthcare professional who is writing to another healthcare professional. So you will be using English for a specific purpose. So as he has already mentioned, you will not tell that the patient was given the medicine. You will obviously use it as the patient was administered. Okay, so that is one example that Chris just mentioned. And the word count is somewhere between 180 to 200. Now, sometimes when the case notes is very simple, it does not mean that you can write everything that is given in the case notes. That is what we'll be talking about today, which is content. Okay, so these are the marking criteria which you can see on my screen. And the first one was just done. And now we're doing the second one, which is content. All right, which is scored separately from 0 to 7. Now, let's understand how to pick the content. Choosing the right content involves identifying the relevant information. If I could tell you in very simple words, if a family doctor of the patient has referred the patient to you and he's under your care and now he's fine and you're writing back to the doctor, then you do not need to include a lot of past history of the patient. Also, you do not need to include the social history of the patient. The reason for that is the family doctor knows the patient and he knows everything about the patient. So what you need to keep in mind is from the time the patient came to you till he's going back to the doctor. So that is the information that the doctor does not know, the family doctor. And keeping that in mind, keeping the person who's reading the letter in mind, you need to pick your case notes. So first, determine what the reader needs to continue caring for the patient from the information provided in the case notes. So what is the information that the person who's reading the letter needs to care for the patient? And is it relevant? Okay, does it impact the care of the patient? That is what you need to think of. Now, representing the case notes accurately is another point, because you need to transform your case notes into complete sentences. Now, I will be showing you the case notes. In the case notes, it is given in note format or short forms. So they give you bullet points. So because, of course, it is an English exam, you need to form complete sentences which are clear, but you need to keep in mind that you need to maintain the original meaning. So we will be going in detail regarding all that, of course, when you sign up for the class, because you need to know how to form the sentences correctly as well. Now, implementing conciseness and clarity. Now, as it is important to pick the relevant case notes, in OET, it is also important to leave out the irrelevant case notes. So you cannot be including irrelevant case notes as well. Okay, so that is a very important marking criteria. That is, just to increase your word count, you cannot use irrelevant case notes. The reason is, in a healthcare setup, everybody has limited time. So in that limited time, if you're reading a letter, it should not impact the care you give to the patient. So irrelevant case notes will impact that. And that is the reason we have to not include irrelevant case notes. Just as I mentioned in the example of the family doctor, where you do not need to give the family doctor the information about the patient's past history, and of course about the social history, because the doctor would already know about that. Now, so identifying irrelevant, focus on excluding unnecessary details while clearly summarizing the information in the reader's needs. Now, summarizing information is also very important because there will be a lot of information given. For instance, if I can give you an example, let me show you case notes here. Now, first, when this is case notes, and towards the end of the case notes is where you'll find your writing task. Now, this is for a practice. It is one case notes with 3 different writing tasks. The reason I've picked this is, from this you will understand how, depending on the person you're writing to, is how is the case notes that you will be picking. So the first writing case notes asks us, using the information given in the case notes, write a referral letter to Ms. Prabha, Shrishti Nursing Home Care Agency, Sydney. And what is the purpose of the letter? Requesting a home visit to provide instructions on self-monitoring of blood glucose levels and administering insulin injection following Mrs. Ramurthy's discharge. All right. And the second one is to a dietitian, where the dietitian needs to send Mrs. Ramamurthy recipes for low-fat diabetic diet. And the third one is a discharge letter to the husband of the patient. So let us see how the information changes. First, let's go through these case notes. It is one single case notes with 3 writing tasks. This is only for practice. In exam, you just get one writing task. Now, we understand, of course, as Chris explained, the name of the patient. Of course, it's very important. So now what you can do in the 5-minute time that you get to read is, first understand the purpose of the letter and who are you, how are you involved with the patient care. After that, understand the patient's name. Of course, you cannot miss that. And understand why was the patient admitted. Now, the hospital, of course, will not be needed. The patient details married will not be needed for a nurse who is visiting the patient at home and just helping her with making her understand how to administer insulin injection. Okay. So height, weight, BMI will not be needed for this particular letter. Address of correspondence also will not be needed. Now, admitted, of course, this is an important information you cannot miss when the patient was admitted. So you put a star next to it here. And date of discharge, of course, will be needed because this patient will visit the patient at home after the patient's discharge. Diagnosis is extremely important. So we put a star next to this as well on your case notes in the exam. Now, for a nurse who is just going to the patient's house to tell her how to administer insulin injection, does not need anything in detail about her social background. She does not need to know that she has 2 daughters or she lives with the husband. All of this social history can be omitted. You don't need to use any of the social history. Now, conciseness and clarity, coming to that point, you can see it's given here. The diet of the patient is whole milk, ice cream shakes, fruit drinks, donuts, and a whole lot. So you do not need to include all these names in the letter. So how would you write it in a very formal way? All you need to mention is the patient consumes a fat-rich diet. That is the conciseness. Okay. So I hope it's clear till now. Now, again, the medical background, known case of essential hypertension and diabetes mellitus, and the patient is non-compliant with diabetic medication. Now, this information becomes important because the patient is non-compliant with diabetic medication. Therefore, she is put on insulin injection. All right. So this becomes important. So this you put a star next to it. Now, admission diagnosis will not be needed in detail, but we need to tell that this patient has acute appendicitis, which comes in your first para, as Chris mentioned again. the condition of the patient, and why was she, and she's admitted for further evaluation and management. So the admission diagnosis will be needed. So you can underline that. Now, physical examination, when the patient came to the hospital, whatever was done becomes irrelevant to a nurse who is going to administer insulin injection, or just going to tell the patient, show the patient, demonstrate how to administer insulin injection. So the nursing management becomes irrelevant. So you do not need to include all this information. Sometimes the case notes gives you a lot of information. Okay, so this is how you pick relevant information, by keeping the person who's reading the letter in mind. Think of yourself as a person who's reading this letter. What information would you need? Okay, that makes it easy for you to pick the case notes. Now, okay, so the discharge plan is always very essential. Okay, whatever comes in the discharge plan that is just above the writing task, you'll see your discharge plan. So all that becomes relevant, and you need to include that. Now let's look at the writing task 1 and the writing task 3, how it changes. Okay, the first letter is a referral letter to a nurse requesting a home visit, and the third writing task with the same case notes. We are using the same case notes, but you'll see the difference in writing. The third case notes is for the husband who will care for the patient after discharge. Now let's look at some sample letter here. You can see it. The first paragraph, of course, is very clear. Thanks to Chris, he said it really well. Now, on admission, the doctor commenced her on conservative management. So this is very concise. They have not explained in detail everything that was done. All right. So this is one sentence that is enough for the patient to understand it. I'm sorry, for the person who's reading to understand it. And this patient has a plan. She has a planned interval appendectomy after 6 weeks. Now, the reason it is planned after 6 weeks is because her sugar levels are high and she needs to take insulin injection. Then it is mentioned she responded well to the treatment and significant progress in her condition. This is all the information that is needed to this nurse, that she has a surgery after 6 weeks. Now, worthy to note, this is very important. She has had type 2 diabetes, since 2010, because this is relevant information and has poor compliance with its management. She was reviewed by a dietitian who educated her on the role of proper nutrition in the management of diabetes. Now, do you see this information? She was reviewed by a dietitian. All that information about her consuming a fat-rich diet and how all that information is omitted. But the one single statement says that she was reviewed by a dietitian and she needs to manage her diabetes. He has educated her regarding proper nutrition and management of diabetes. Then, as well as an endocrinologist who advised her to chart blood glucose daily and control her sugar levels with insulin injection until her follow-up scheduled on 30/6/2017. The last para, she has been educated on, this becomes important. This is where you elaborate what you have mentioned, what you have stated in the first paragraph. Now, in the first paragraph, you state that you're requesting for a home visit. The question why is answered in the last paragraph. She has been educated on necessary home care following her discharge. However, she lacks confidence with self-monitoring of glucose level and self-administration of insulin injection. And that is the reason you're writing to her. Therefore, her husband has requested a home visit for instructions on correct technique. So now let us look at the letter. Now, I'll not be doing the dietitian one. Let's look at the letter to the husband. Now, when you're writing to the husband, does the husband need to know why was she admitted, when was she admitted? Because he already knows it, right? So we can omit all that information. Let's see this letter. I'm writing regarding Miss Anita Ramamurthy's. Why are you writing the letter? Again, the question, future care requirements after being discharged. Her recovery has been encouraging so far, but continued monitoring and attention will be necessary. So you need to improvise according to the letter, okay, depending on the person who's reading the letter. Now, what is her condition? So here we are not at all mentioning that she has appendectomy because the husband already knows about it. So Ms. Ramurthy made significant progress in her condition during her stay, and her infection is controlled now. Her surgery has been scheduled in 6 weeks from today. Following her, now this becomes important because after discharge, whatever has to be done, which is mentioned, whatever has to be done is mentioned just above the writing task. So everything here will be mentioned in the last para. Okay. So what she needs to do besides she cannot travel. She needs to chart blood glucose daily and her sugar levels with insulin. We are aware of your wife's concern regarding this. Therefore, a home visit by the nurse has been arranged for instructions on correct technique. In case she experiences persistent pain or fever, please contact us immediately. So this 2 case notes tells us clearly how you need to leave out irrelevant information and include relevant information depending on the person who's reading the letter. Okay? Because it should not impact, the letter should not impact the care you give to the patient. So this is about how picking the right information is important. So yes, the other things, of course, as Chris said, you'll have to sign up for our classes, and then we'll be letting you know about the grammar usage as somebody asked. Also, regarding the, there are different symbols that come in OET writing, like a question mark or arrows. All that will be explained.
All right. So before we dive into the Q&A session, I would like to take a moment to celebrate some of our own. These are our recent OET winners. So they have trained with us, they have put in the effort, they've stayed consistent and achieved the scores they needed to move forward in their international careers. So seeing their success is always inspiring, and it's a reminder that with the right guidance and mindset, it really is possible. So as you can see from the screen, 2 of our candidates, Viva, Joy, and Malati, both of them just gave their OET exams on June 14th. And in a week's time, they have scored such wonderful grades and scores for OET. And we hope their journey gives you that extra bit of motivation today, because you all could be the next winners. Okay, so we hope to see your photos and your scores displayed like this for our future webinars. So on the same note, we do have some offers lined up exclusively for the attendees of this webinar. So we have a few added benefits for you today, and the validity of these offers will be till 15th of July, and the details will be shared in the chat box as well. So what you will get is basically 1,000 rupees off on our 4 weeks OET training. Please take note of this. 2,000 rupees off on our 8 weeks OET training. You will be getting 1,000 rupees referral bonus for every friend, family, or colleague that you refer to our institution and who wants to take our course. And additionally, this is exclusively for first timers or repeaters also. It is a free exam booster pack to help you with your final OET prep. So these are the offers that we have lined up exclusively for the attendees of this webinar, and 15th July is the last date to enroll, and you'll be able to avail all of these offers. And if you're planning to start OET training, then this is the perfect time. Do not miss out on these offers. All right. So now we can move on to questions. If anyone wants to speak, please unmute.
Hello.
Yes.
Hello,
Yes,
ma'am. I
Ankit.
have a question.
Yes.
Ma'am, right now the hiring at NHS is closed, and I have seen many of my friends have cleared OET exam and their result has expired. So, is it a right time to prepare for OET and give exam, as there are no present openings in NHS?
Well, actually, NHS is hiring directly. That is not through agencies, but they are hiring directly. And we at Global Nurse Force, we are providing assistance for such applications. It is exclusively through a portal called Track. And if you want to know more information about it, please connect with the number that is displayed in the chat box right now, and they'll be able to give you more info about this. And yes, OET is accepted in other countries also, so it is not only for UK.
Thank you. Thank you.
About the fees, we will be, you can, like I said, contact in the number that is displayed in the chat box, and we will be sharing the training details as well as the fees, and you can avail the offer also.
Hi, ma'am.
So, yeah, hi.
Ma'am, how long period is taking for clearing this exam, ma'am?
Well, if you're consistent and if you are ready to put in the hard work and consistently attend the classes, it completely depends on your potential as well as if you receive the right guidance, then we are offering 2 months training course. So basically you will be able to clear if you are guided in the right way also.
Hello, ma'am.
Hi, Ria.
Good evening, ma'am.
Good evening.
Ma'am, your agency provide New Zealand, Australia pathway.
We are providing processing assistance for Australia. That is, we are helping with AHPRA assistance. So I can see a lot of questions in the chat box. Basically, OET is not only for UK, it is accepted by most English-speaking countries. And expiry is 2 years. Or the score, once you've got a score in OET, the validity is 2 years. We do have group sessions as well as one-on-one sessions. Anything related to our course, anything related to our training program, please connect with the number. Connect in the number that is provided in the chat box.
Ma'am,
Yes,
are you
Anuradha.
giving IELTS training?
Yes, like I said, you can ask all the training questions in the number provided in the chat box. For now,
Because my
yeah, tell
husband
me.
is not for a medical background. He's the
Mhm.
IT engineer.
No
So
problem,
he
no
want to write
problem.
for IELTS exam. So that's what I'm asking.
Okay, so we are providing IELTS as well as PTE too. So it is open to the market. It is not only for nurses and doctors or healthcare professionals in general.
Ma'am, did you provide NCLEX also?
Yes, we do provide NCLEX RN training. Yes, Abhinaya, is there anything more?
Yes, IQN also, ma'am. For New Zealand
Sorry?
registration. IQN.
No, we are not providing assistance for New Zealand. Does anyone have any questions related to OET exam or maybe the modules? Maybe the writing was discussed here. So does anyone have any questions about that?
Hi, ma'am.
Hi, Madhira.
Yes, ma'am. Ma'am, recently we have heard that currently UK is not recruiting nurses like that. So is it really true?
As I have mentioned in the beginning of this Q&A session, NHS is hiring directly. So vacancies are available through the track portal. If you would like to know more details, please connect in the number that is provided in the chat box.
Okay,
Ma'am, I have a question regarding
Yes,
exam.
Ankit. Yeah.
Ma'am, if we are unable to clear any one of the module, then can we give appearance exam only for that particular model in which we have failed?
Well, if you're opting for the pen and paper type mode of exam, then it is not possible. You'll have to repeat the whole thing. That is all 4 modules you'll have to repeat.
Okay, if we are taking computer based, then we can repeat one module.
Not in India. As an Indian national, you won't be able to do that. You will have to repeat everything.
Ma'am, could you please tell me how much experience we need to register AFRA, ma'am?
For AFRA, you need 2 years of experience or 1,800 clinical hours has to be completed.
What about the work experience gapping, ma'am?
Sorry?
Is it acceptable? The work experience gap, ma'am. Is it
Gap,
acceptable?
you should be recently working. That is, you should be working at the present.
They don't accept any work gap or like that.
Not for 2 years. That is, you should be continuously working for the last 2 years. So I have a question in the chat box. It says, after passing of OET, anything to be paid agency or directly to be hired, I believe. So we are providing no cost placement. That is, we don't charge any recruiting fees. Yes, directly, no. You just have to apply directly to the NHS and we are providing assistance for that.
Ma'am, only online classes or offline you are providing?
We are providing online live classes. So I believe there is a question about writing that either Kumuda or Chris can take. It's in the chat box. Do we need to write full name in first paragraph like Mr. Edward Tidyman, or can write Mr. Tidyman?
First paragraph, yes, the full name. After that, it's in the beginning of the paragraph, you start with the surname of the patient, the second name. All right. And then you, of course, refer to the patient with a pronoun. If it's a man, it will be he, his, or if it's a woman, she and her. Okay. In the first paragraph, yes, the full name.
I hope your doubt is clear, Durga. And the minimum experience to work in the UK is 6 months. We have another question in the chat box. Do your institution provide only training or the complete procedure? Basically, yes, we provide in processing assistance also, not only training. We are the training and development division of Global Nurse Force, and Global Nurse Force has been leading healthcare recruiter for more than 20 years. So yes, we do provide processing assistance.
Hello, hi.
Hi, Prasad. Yes.
What's the minimum required band score for getting registration in USA, ma'am?
USA, the score required, OET score required is B in speaking and C+ in all the other modules.
Okay. What about Australia?
Australia, same as that of UK, which means you have to get C+ in writing and B in all the other modules.
As of my friends was saying that it should be B in all the models. Is it?
Ideally, that should be the case, but C+ in writing is also accepted.
Okay. Thank you so much.
You're welcome. Okay, so we have another writing related question. Any difference in emergency letters? Kumuda or
Ma'am,
Chris?
in case of one module is getting low mark, then also writing all modules.
Yes, you will have to repeat all the modules. Okay, so I was actually trying to make Kumuda answer a question. Any difference in emergency letters is a question we have in the chat box.
Yes, in an emergency letter, see, there are two ways of writing a letter. One is chronologically and one is thematically. In case of an emergency, the first para, it should be very clear because it should not impact the care given to the patient. So in case of an emergency letter, that is what comes first. Okay, so you'll not go chronological when the patient came first to you, second to you, no. It will be thematically.
Okay, thank you, Kumuda. Now, Ismail, you can go ahead.
Yeah, ma'am.
Yes.
Regarding the USA recruitment, does all the provinces in USA accept the OET score?
Actually, more than 40+ states in the USA have started accepting OET as of this year. So you wouldn't have to worry about OET not being accepted in the US now.
Okay, ma'am. Thank you so much.
You're welcome.
I have one more doubt.
Yes, please go ahead.
Yes, I'm Prasad. Still, pencil is accepted in OET. Shall we use the pencil?
I think Kumuda will be able to answer this. You're on mute. You're on mute.
I'm sorry. Yes, it's better you write in pencil, Prasad, because, sometimes you may have to erase. And a formal letter should be very neat and clean. Okay, so it's...
Yeah.
So when you
Recent
write...
update was...
That was for IELTS.
Okay, sorry.
All right, so I will take one last question. And because of time limitations, we need to end the session. So if anyone has a question, please ask now. All right, so thank you all for those thoughtful questions, and I hope we were able to help you. And this brings us to the end of this very informative session. A huge thank you to our expert speakers, Chris and Kumuda, and to all of you who attended. If we didn't get to your question today, or if you have any other concerns or doubts, don't worry. Our contact details are available in the chat box. And so please click on that link and you'll be able to get directly in touch with us. And we'll definitely, I promise you, we'll definitely be following up. So if you're ready to succeed in OET and begin your international nursing journey, don't wait, don't hesitate. Join our OET program, and GNF Career Pathways is here to guide you. So once again, thank you all for joining us today. Wish you all a wonderful week ahead. Good night and stay safe.